So the other day, me and my good friend Brad Dieter were talking. He mentioned that he had a knee issue, and he then subsequently after that noticed that his glutes were firing a little asymmetrically. So right to left, he couldn't really get the same sort of contraction. So he messaged me and asked, what do you have for glute activation? How can I kind of progress through some different glute drills? So if you're looking at common fitness sites, Muscle and Fitness, Muscle and Strength, bodybuilding.com, T-Nation, a lot of what you're going to see is sagittal plane dominant exercises. And what I mean by sagittal plane is simply forward to back. Those are going to be those that train hip extension primarily. So you're going to have hip thrusts, glute bridges, Romanian deadlifts, any other sort of hip extension movement, squatting, kettlebell swings, you name it, you've seen it. But the thing that all of these sites sometimes neglect to talk about is that the glutes function in all three planes, meaning that they also function laterally, side to side, frontal plane, and they also function in a rotational capacity, meaning that they determine external and internal rotation of your femur, this big long bone here. So if we're only training in the sagittal plane, we can run into issues then with being able to control internal and external rotation. And people might say, well, I'm not an athlete. I don't care about, change of direction, agility. None of that really matters to me. Well, that's fine. But consider this for a second. When you're squatting, the femur is functioning in all three planes. Now, you may not know it, but it is. For example, as you're going into a squat, below 90 degrees, the glutes, some of the glutes, change from external rotators to internal rotators. Think about this. If the glutes are primarily an external rotator and you're going into a squat, they are having to essentially limit how much internal rotation you can get. So, if I can't get into a squat for whatever reason, it might be due to the fact that I either A, have glutes that are too weak to externally rotate, and I can't hang out in this bottom position because I don't have the strength to maintain it, or B, I just don't train outside of the sagittal plane enough to give myself that rotational control. So it is very important, and that's what this video is about, understanding how you can apply it and the different implements you can use. First one, resistance band. A lot of gyms have them. Some popular gyms like Gold's Gym might not. They're kind of becoming trendy now, so you might be surprised. But simple, stand on the band, about a shoulder width stance, cross the band, and then simply pull up. These are called X-band walks. Good athletic base position. Keep the feet wide, and then just take little side steps. You can also take it up in the sagittal plane, so now you're having to push out, externally rotate. Take steps forward and steps back. Don't let the width of your feet change as you're going forward and backward. You can also go diagonal. Lots of different variations there. However, if you've got a TheraBand, which is just basically this thin piece of rubber that I tied together, or you have a mini band, you can upgrade your glute exercises. First one, good athletic base position here, shoulder width stance, band goes around our knees. As you get stronger, you could progress to 2 bands, one around the knees, one around the ankles. For starters though, just start on the knees. Here, you're going to learn to control rotation within the transverse plane with just a single leg, internal and external rotation. Most important thing, watch the outsides of the shoe. If that's coming up, you've gone too far, or the person doesn't understand how to move the femur with the glute, and they're trying to substitute motion at the ankle for the hip. Second one, same thing as the other band, good athletic base position, small little steps. You're pushing off this back one and you're absorbing with this front one. So here, this glute is going to activate. Activate, absorb. You should feel these primarily up high near your glute med. Two common mistakes, bringing the feet together and also standing up during reps. Maintain this good base position and the width of your feet. Third one is simply to now start to move in the sagittal plane and incorporate other planes. Just like with the other band, taking a zigzag, taking in a box. Keep the feet apart, go in all sorts of different patterns. Fourth one, simply a reach. Load one leg. Load my left leg here. With this leg, all I'm going to do is tap the toe. You're trying to really reach with this leg. A lot of people, what they'll do is they'll kind of just tap, tap, tap. You're looking to reach. Get some glute activation out of this glute and this one. Remember how I talked about the glute functions in all three planes? Hip extension, here, adduction. This fly will not stop buzzing. God. Adduction and external rotation. So, here, we're getting some adduction, as well as controlling the band from pulling me into internal rotation. So does that make sense? We're getting two for the price of one, essentially. All right, here's what else you might say. Well, I don't have any bands. What should I do? Good question. First thing first. Get really good at glute bridges. Start bilaterally, and you should be able to activate just the glutes, no low back. So if you're getting a pump within your low back, or you're feeling just hamstrings, these guys should be nice and quiet, for the most part, when you're going through glute bridges. If you can't feel the glutes, get a partner to put their hands on either side of your knees, and as you bridge up, push your knees out. Similarly, if you're someone who's more overextended and you have more of an arch back, put something in between your knees, squeeze it during the rep, and then focus on bridging your hips up. And you're probably going to find that your glutes kick in a bit better because now you've engaged your core more. Second progression. Bridge, reach, over top. What we're doing, we're lengthening the lat on the one side, so then as you reach across, you're getting a rotation at the hip that you're having to fight, so that glute's going to engage more. So bridge, reach. This glute's going to kick in harder, but now I'm getting a stretch of the lat, which is helping to inhibit the backside or the posterior muscles and keep my abs turned on. Third progression. Single leg bridge. So lift one leg and back down. You can progress into a march. So one up, make it a little bit more dynamic, or just a single leg bridge altogether. And final progression, if you wanted, would be like a straight leg bridge. And that would be if you put like a foam roller underneath your ankles and you try to do a hip bridge with that under your ankles. So lots of different ideas there for glute activation. Oh, and I almost forgot, no band. That was all sagittal plane stuff. If you have no band, what else can you do? Well, you can do the same sort of reaching activity. Now you just really got to focus on this glute here. You're trying to just squeeze this glute. Once you've established a good mind-muscle connection, you can do a lot of these exercises without a band and focus on the actual intent of the movement, meaning you can activate that glute equally as hard without the resistance. So focus on that reaching one. Then you can add in something like a lateral lunge, slowly, progress it, to more dynamic, where you have to absorb force and then push back. And then you might add in something like a 45 degree or a curtsy lunge, a bowler squat. This goes by a lot of different names, but it's basically a step behind at 45 degrees, loaded to the hip, and drive back up. So from the side, it'll look like this. Pretty simple. Again, you're looking for the glutes on this. You can't feel the glutes and all you can feel is spinal erectors and you're getting a pump in your low back. Take it back down to the floor. Start with glute bridges. Start with your good athletic base position with a band around your knees. Working one knee and then both knees. Start with the basics. Work your way up. Learn to walk before you try to run. Hope that helps.